Last week of April marks World Immunization Week. It aims to highlight the collective action needed to promote the use of vaccines to protect people of all ages against disease. To discuss the importance of immunization, UNICEF South Africa's representative, Christine Muhigana, joins us now for that conversation. Christine, thank you. I was just reading through what the WHO has put out ahead of World Immunization Week, and basically they're talking about all the things that people have gone on to achieve after being immunized, tracking back the history, if I'm not mistaken, to around 1796 that, actual public vaccinations started, and all the things that people have been able to achieve, becoming doctors, teachers, stars, soccer stars, etc. Just as we mark the World Vaccination Week, Immunization Week this week, how far have we progressed, at least in the last 2 years or so, in this conversation about the importance of vaccination?
Thank you. Good afternoon, and good afternoon to your viewers. Thank you for allowing us to join our partners, WHO, Gavi, on this important week, where we want to remind ourselves and the world that immunization, so vaccination, is the most cost-effective public health intervention that's available to us. As you just said, we've come a long way through the pandemic to make sure that we protect the gains that you just alluded to, that WHO is reminding us of in terms of immunizing children, immunizing people, so that we can go on and become healthy, productive people. The theme for this week's World Immunization Week is long life for all in pursuit of a long life well lived. And as you said, people grow up, or children grow up to become doctors, to become nurses, to become scientists, to become presidents, to become, all kinds of productive people in society and in the world. So we're here to celebrate that and remind ourselves that vaccines work, and we need to be aware of that and promote the fact that people need to be vaccinated and make themselves or avail themselves to this technology, to this wonderful innovation that prevents preventable diseases.
So what's your assessment of the impact of the pandemic on the conversation around vaccination? Has it served to energize and focus on the importance of vaccination, or has the dominant feature been that we've focused so much on vaccination for COVID-19 such that the other vaccines are not really being followed through, particularly in the younger stages of someone's life, not really being followed through with the vigor that is required?
So absolutely, the COVID-19 pandemic has been a distraction in terms of the time, a distraction in terms of the investments, the resources that would normally have gone to routine immunization. But luckily, UNICEF, WHO, Gavi, partners, the National Department of Health, very importantly so here in this country, we're here to make sure that we protect the space that routine immunization and immunization of children needs to have, as of course the response to the COVID-19 pandemic was going on. So in the last couple of years, we've had to work with the National Department of Health in this country to conduct catch-up drives so that children who were not going to health centers, children who were not accessed or who were not accessing immunization services were actually reached so that they can get the life-saving vaccinations that they needed. We worked with the National Department of Health with partners to strengthen, for example, the cold chain system. This served the purpose of the response to the COVID-19 pandemic, but also making sure that the routine immunization continues to be strong and serves children who need to be protected from preventable diseases.
But what about the conversation about skepticism, Christine? I imagine that you follow that quite closely. And also, if not skepticism, perhaps an opting out, a conscious opting out of getting vaccinated. As we speak, just last month, this country, South Africa, was announcing that no less than 80,000, doses were going to be destroyed because they were simply not being taken up and they were approaching their expiry date. I saw a report that talked about a higher number in Kenya, something in the region of 840,000. What's your sense there of achieving that balance of, nudging people, get vaccinated, but also without being overly overbearing as a state, as officials, as international aid and health organizations, and leaving that space for people to be able to exercise choice as well and autonomy? How have you weighed in that conversation and that balance?
Yes, so vaccine hesitancy is an issue that we had to deal with already before the COVID-19 pandemic and the whole information or misinformation, I should say, about how vaccines work that has accompanied the rollout of vaccines against COVID-19. But what I would like to underline here as we talk about immunization for children and routine immunization is that actually in this country, 1 in 5 children continues to not be reached by vaccines that prevent, diseases, that prevent death in children. There is some hesitancy around that, but it is actually mostly about families and these children having access to the vaccines. It has to do with poverty. It has to do with transport. So it's very important that we keep on this awareness campaigns, that we keep on promoting and spreading the word of the evidence that we have around vaccine working and vaccine preventing disease and death in children, whether here in South Africa, on the African continent, or around the world.
All right, I've got to thank you for your time and your insights ahead of the World Immunization Week. That is Christine Muhigana, who is from UNICEF South Africa, the South African representative of UNICEF. And that's how we come